Hi, I'm Meg Callahan with Infectious Disease Special Edition. I'm here with Sunil Solomon, who's a professor of medicine at Johns Hopkins University. We are at CROI 2026, and you just gave a very big talk that was very timely politically. Could you maybe talk about what the problem is that you talked about?
So my talk at CROI is more about how do we do research in these turbulent times. And the way I'd structured the talk was we broke it down into why do we need to keep doing this. So I think all of us do research, and many of us get carried away with everything in academia, which is all about publications and impact factors and journals, and we forget why we're actually doing this, right? Because at the end of the day, there are billions of people across the world who are either living with HIV or who are susceptible to HIV, and that's really the reason we do this. And I think what we need to figure out is how do we keep in mind that, yes, the world is unfair at this point in time. Grants are being terminated. Certain words are being considered wrong. Certain populations they're trying to be disappeared. But we need to figure out how we continue to do science, because whatever we do in a lab or in the clinical trial or on the field has to reach every person on the field across the world who needs it, because that really is impact. And that's why we need to keep doing what we're doing, because there are billions of people across the world who depend on it.
So how would you go about this without government funding?
So I think it's easy to say, but it's harder to do. So I'm telling you what I think we should be doing. And I think the first thing we need to do is change. Right? Because if you think about the HIV community, we have been fighters. Right? And like from the 80s, it was the advocacy of not just the community, but the science and the communities together working to push things that got us to where we were in 2004, 2005 when we had PEPFAR. It didn't happen because the government decided to do it. It was like a push. And I think over the past 20 years, we've sort of gotten complacent with it. And we're sort of sat back and just gotten used to the way things have been rolling out. And I think what we need to do is really change. It's very hard to do. We hate change because when you get used to a particular way of doing things, we don't like to change, right? But change is inevitable, and it's something that we have to do. And I always say, like, every challenge is an opportunity. And I feel like the current challenge we're facing with funding is an opportunity to change. And how do we change? And I think the first thing we need to do is, like, as a community, maybe prioritize. Yes, we have to do all the research that everyone wants to do, but funds are limited. And we're sort of competing against each other. So almost as a community, both scientific community and people infected and affected by HIV come together and say, okay, these are the areas we focus on, at least for the short term, right? And figure out what are the most impactful things that we can push through. And then the other thing we also should think about is different funding sources have different priorities, right? So maybe the other way we change is think about how we align what we want to do with who the potential funder is. So for example, if you're doing implementation science, maybe work with host governments of different countries because that's impactful for them. If you're working with basic science for drug development, maybe try to partner with industry or venture capitalists, right? Because that's where there's money, there's investment to be made. And if it's clinical trials, work across academia. And so I think we definitely do need to change and think about prioritizing. And then the other thing we also need to do is start thinking about team science. We keep saying this all the time, we have to do team science, but we really have to embody it. Like, so what is team science? It's like bringing basic scientists together with like data science and AI, because technology has gone so far. We need to figure out how we leverage technology to make us more efficient. And like there's a lot of efficiency that can be gained that just we don't seem to be capitalizing upon it because we're so happy with the way things are working without thinking about how do we actually change, make things more efficient. So that's something we have to do, is build those multidisciplinary teams and really focus on the next generation, because I can tell you, like, what I thought was cool and what I thought works completely changed. When I'm talking to the 25-year-old doctors coming out of India about how do you do delivery for PrEP, I'm blown away, because what I thought was going to work is completely different from how things actually have to work on the field. And I think what we've done is, like, we've been doing this for 20 years, so we think we know what it is. But I think it's time for all of us senior investigators to actually hand over the torch to the junior investigators and switch to that role of mentors. Right? Like, help them grow and try to nurture their ideas, because some of them are crazy. Like, I remember 20 years ago, my ideas sounded crazy to everyone, right? Because I was young at that point in time. But that's what made the whole difference. And I think that's something we need to embrace as like the next generation, get them to start doing it. And then obviously diversification of funding sources. So I wouldn't say the US government funding is gone, right? It still exists. Actually, Congress approved a budget for the NIH, which was higher than last year. So the money exists, but I just think it's going to be a lot harder to get to those funds because we've seen that last year. There were fewer R01s awarded, like almost 2,000 fewer R01s awarded last year, which means funds are going to be hard to come by. So we should still keep focusing on the NIH and trying to figure out how do we do the science within the current constraints of what we're allowed to say, allowed to do, but still respect and protect the identities of the communities that we're working with. So that needs to happen. But at the same time, we need to switch and see who are the other funding sources available. Are there industry? Are there community? Are there venture capitalists? And I actually think we need to get out of this whole thing of like NIH is the only one who could fund us and start thinking about things like social media. And because each of us has the power, like I was sitting at CROI yesterday and we were talking about, even in the room at CROI, there are like 3,400 registrants, right? If each registrant gave $100, you would have $340,000 right there, right? So it's, like we keep thinking of awards as like $1 million or $10 million, but we need to start breaking them down into smaller chunks because everyone can help, right? Whether you're a community member or you're a philanthropic donor or someone living with HIV, right? If you want to see the research go forward, $1 a day doesn't really hurt too many people. Yes, for some people it's going to be challenging, but I think we need to start getting creative about how we raise funds. But I think those need to happen, and we need to start thinking completely outside the box. So I know that was a long-winded answer, but that's sort of how I think we could actually make it happen.
I'm wondering one thing with how much of this diversification in funding is already going on. And then I'm also wondering, I'm a journalist, we think about bias all the time when we're reporting on stuff. How could you diversify your funding stream, but also kind of safeguard against some of those biases that could come in?
No, so I think the diversification of funding is sort of already happening. So let me be honest, I don't think anything is going to ever replace the US government funding. Like USAID, like nothing's ever going to replace it, right? But I think there are enough people picking up small pieces. Like I used to run a USAID program and we were terminated last year, and we used to run 3 clinics for trans communities in India. We were providing services for about 6,000 people, right? But we were able to find local foundations within India to pick it up, right? So there are these small pieces that people are starting to pick up from different foundations, philanthropic donors. There's someone at Hopkins who's raised like $2 million from philanthropic donors who basically gave the money and stayed away. They said, you run the research, right? So that comes to your bias areas, like give us the money, but don't get involved and don't ask to see the data, don't ask us to control the data, and definitely don't analyze the data. And it depends on the source of funding. If you're a philanthropic donor who's donating for a cause, then yes. But if you're a venture capitalist or industry who has an interest in the outcome, then we would do the same thing we do with phase 3 trials, like make sure that whoever has something to benefit from the outcomes of the research is kept more than an arm's distance away from the data analysis, right? If I have stock in that company, then I shouldn't be analyzing that data. It should be someone else. And I think those are safeguards most IRBs will place because this research is still going to happen within an ethical framework, right? It's not like we're going to take the money and run to the field and do whatever we want. It still will happen. It's just the source of the funding is going to change. But I think there are enough guardrails around ethical review where they check for conflicts of interest and make sure that there is that separation between who's funding and who's evaluating to make sure that the biases that you talked about don't exist. The other thing I would also say is like in today's world, there is data everywhere. Right? Like if you're doing implementation studies and trying to impact something at a population level, there is health department data, there is data on like Google Analytics, right? You can start looking like, for example, if you were doing an evaluation program to see like, did my new campaign on improving PrEP awareness work? You could just look at Google data analytics in that region, like come down and see how many people have been looking for PrEP and did that change when your program came out? There's really no way of manipulating that data. So there are multiple ways of like looking at the same outcome when you're looking at larger scale studies, but I think when you're looking at smaller like research studies, there will be safeguards in place that will keep that separation so we don't have to worry about the biases.
One of the last things I'm thinking about is, so one of the problems with the government funding that's still available, and you kind of mentioned this, is that there are certain groups that basically if you mention them in that you want to study them, that you don't get funding. I'm talking about trans people, maybe people who use drugs, stuff like that. Diversifying this funding, do you see that as a solution to funding this research?
So it's two things, right? So one is, yes, diversifying the solutions. I think there would be a lot of advocates who would support trans work and sexual gender minority work, right? It may not be the current priorities of the current administration, but there are other sources. But that being said, I think we also need to think about things smartly, right? Because like a trans person or a person who uses drugs is a person, right? Like there's nothing from the NIH that says you can't do research on people. So I think the way we frame it is we're doing research with this particular group of people without really having to name them. There are people whom we're working on. But I think what we need to recognize is when we do that to get through the different restrictions that are being caused and how funds are going to be released, we remember that these are the communities we want to work with. These are the communities we respect. These are the communities we need to protect. And that we should never forget, right? So it needs to be a sort of separation of what goes into the ground and how we implement it. And I think people like us who've been doing this long enough can figure out how to actually